So you woke up with a stiff neck, or what I call a sleeping injury. And I call it a sleeping injury because it usually happens either right when you wake up or a couple hours after waking. It's almost always on one side of the neck and sometimes can be accompanied by a headache on the same side. This condition is usually precipitated by stress, and so to prevent it in the future, make sure you go to sleep in a calm, relaxed state. Remember, the mental state that you go to sleep in, whether good or bad, can influence your sleep throughout the night. But you're in luck, because a stiff neck can often be relieved by exercises alone that you can do on your own. The exercises I'm going to show you should be repeated about 5 or 10 times or until the pain becomes manageable. And as the stiffness creeps up during the day, you can just repeat them as needed. But before we begin, I'd like to introduce you to the muscles that are the culprits to the stiff neck syndrome. So the stiff neck is usually caused by this muscle right here that's on the outside of the neck called the levator scapula. And sometimes it can refer down to the middle of the back or out to the shoulder. And then if you have a headache that's accompanied by it, it's usually this muscle right here that refers the headache pain across the head. So the stiff neck on the left, what you want to do is rotate your head to the left into the pain, and then kind of back off a tiny bit. Bring your left hand up and then push to the left as if you're rotating or turning your head to look at something behind you. This should only be about 10-20% of your strength, and you want to hold it for 10 seconds. And then bring your right hand up to the right side of your head and do the same thing. You're going to rotate your head this way to the right, out of the point of pain, and then bring your head forward. And then we're going to do lateral flexion. That's bringing your ear to your shoulder as far as you can, get to the point of pain, and then back off. And then again, look in a mirror and get a visual examination of how stiff you are so you can see your improvement. Go ahead and bring your hand up and then push down as if you're bringing your ear to your shoulder. Again for 10 seconds. And then bring your right hand up and then push out of the pain in this direction. Again, only 10-20% of your strength. This shouldn't cause a lot of pain. And then bring your head back into neutral. You should almost see improvement right away. So go ahead and bring your head again to the left, and you should see that maybe you can go a little bit more. Back out of the pain. Bring your left hand up and rotate or turn your head as if you're looking behind you. Again for 10 seconds. And I'm going to stay here with you and do this with you in full time. And then bring your right hand up. And then again, you're going to rotate or turn your head into the right. Again for 10 seconds. Bring your head forward. Again, go into lateral flexion. Bring your ear to your shoulder. You should be able to go a little bit more this time. Bring your hand up and then push in for 10 seconds. And then bring your right hand to the right side of the head and again push up. Again for 10 seconds. And be nice to your neck, be nice to your body. Don't push things too much. So to summarize, you want to turn your head to the left, bring your left hand up, rotate for 10 seconds into the pain, rotate 10 seconds out of the pain. Again, lateral flexion to the left, push into the pain for 10 seconds, and then out of the pain for 10 seconds. So then if your pain is on the right, you want to turn your head into the right and kind of look to a mirror and kind of get an idea of where your stiffness is so you can see your improvement. You want to bring your right hand up and you want to go ahead and turn into the right. Right rotation, or you're looking behind your shoulder. And you're going to only push for about 10% of your strength, only for about 10 seconds. And then bring your left hand up and go ahead and turn into the hand, rotating to the left, but maintaining your range of motion. And then we're going to do lateral flexion. That's bringing your ear to your shoulder. So go as far as you can. And again, maybe look into a mirror and get a visual idea of how stiff you are. Bring your right hand up, push into the right for 10 seconds with only about, again, 10 to 20% of your strength. There shouldn't be any wincing or pain with this. And then bring your left hand up, and then you're going to push up away from your shoulder to the left for 10 seconds. And I'm doing this in real time with you so we can do this together. And then once again, go ahead and repeat it. Turn your head to the right, and you should be able to go a little bit more. This is pretty immediate, this therapy. And then bring your right hand up and go ahead and push into the hand, looking behind you, again for about 10 seconds. And then bring your left hand up, and then you're going to rotate again to the left for 10 seconds. 4, 3, 2, 1. Then look straight ahead. Lateral flex to the right. You should be able to go a little bit more. Bring your right hand up, push into your hand as if you're bringing your ear down to your shoulder for 10 seconds again. And then bring your left hand on the left side of your head and push up against your hand for about 10 seconds. Again, maintaining the range of motion. So you want to do this action, but you don't actually want to turn your head. Just push into the hand. And now you want to keep repeating this. And I'm going to review. Go ahead and turn your head to the right. Bring your right hand up and push into the right. Then bring your left hand up, push into the left, 10 seconds. Bring your head forward, bring your ear to the shoulder. Again, press into that to the right for about 10 seconds. And then bring your hand to the other side and push up against your hand for 10 seconds. So you've completed the exercises, and maybe you still have a little residual pain in the muscles. So this is the massage tool that I use for hard to reach places. It's called the TheraCane, and it's fairly inexpensive, and you'll definitely get a lot of use out of it, so it's well worth the investment. Click below for more info. So the two muscles, once again, that are involved in this stiff neck syndrome is this levator scapula right here. And then if you have the headache accompanying it, that's this suboccipital. So the TheraCane, to work the left side, you want to hold the TheraCane like this. For the sake of this video, I'm going to be utilizing the right side. So right here is the muscle. It comes here and it attaches right down here at that top of that wing of the scapula, that bone. And you want to just press in pretty aggressively, pretty deeply, kind of go back and forth, a little cross fiber friction. Make your way up. Now, here's the center of the spine. This muscle is really almost over to the side of the cervical spine. You can massage the muscles that are right next to the spine. They could be involved as well. And for the sake of demonstrating, I'm showing this standing up, but ideally laying on your back where your neck muscles are in a calm, relaxed state would be the best way to massage these. So you're starting here at the bottom. This is one of the attachments. Slowly working your way up, kind of doing deep back and forth motions or just static motions, all the way up, and this muscle comes and attaches really kind of at the very top of the cervical spine, the base of the skull. And then you can go from the top and work your way down, all the way down to that attachment again. Now, if you do have the headache involvement, it's a little tricky to massage the suboccipital, but basically you find your skull, the hard bone right here, drop off, press in, and you're going to go up in a kind of an upward diagonal, and you're going to work the whole muscle from the center to the outside, because this muscle just attaches the skull to the first part of the neck. And as you're massaging in this area, you may also feel a little bit of that headache, pain, and that's good. It means you're triggering the trigger point. You could do this therapy sitting up, but because the neck, like your spinal muscles, they're postural muscles. So it's probably better to do it face up or on your side where the muscles are in a relaxed state. So I'll go ahead and demonstrate that now. Once again, You're working right below the skull on the side of the neck. And you'll know because it'll be painful. And just follow down, back and forth strokes. And my neck muscles are completely relaxed at this point. And then going right to that attachment of the muscle, right at the corner of the scapula or your wing bone. And then if you have that secondary headache, again, drop off the skull right next to the spine and just do back and forth strokes. Back and forth all the way to the side. And try to see if you could press in really deeply and find that trigger point going up the head. And if you do, just hold it there for 10 seconds. And then again, you can do it face up using that torque ability of the Theracane. And you can get in there really hard and really work those muscles, which you want. You want the pain levels to be moderate. That way the therapy will be effective. And you want to continue massaging for about 10 to 15 minutes. And then after the massaging, go ahead and apply ice in the affected area for 20 minutes. And you want to do that every hour. So let's say you started it in the evening, 6 to 6:20 ice, then 7 to 7:20 ice, and then 8 to 8:20 ice. And do that as much as you can. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.